Hello everyone, this is Dr. Sangeeta Chaudhary once again and I welcome everyone to my lecture class. आज के क्लास में मैं डिस्कस करने वाली हूँ हाउ टू डू एग्जामिनेशन ऑफ अ फेशियल नर्व. मोस्ट ऑफ द टाइम जब हम बेड साइड क्लिनिक्स में क्लास लेते हैं या फिर मोस्ट ऑफ द टाइम व्हेन वी सी पेशेंट्स ऑफ स्ट्रोक, द कॉमनेस्ट नर्व टू बी इन्वॉल्व्ड इज फेशियल नर्व. So it is really important that we know how to examine a facial nerve, okay, and how to detect facial nerve palsy. तो वही है topic of discussion of this class. So first of all, I just want to mention that facial nerve is the 7th cranial nerve. There are 12 pairs of cranial nerve. We know that. Facial nerve जो है ये 7th cranial nerve है. Facial nerve is a mixed nerve. Okay, क्यों mixed nerve? Because it carries both motor as well as sensory fibers. It also carries autonomic fibers as well. जो फेशियल नर्व है उसको दो नर्व रूट होता है. वन इज मोटर नर्व रूट. जो मोटर नर्व रूट है इट कंप्राइजेज ऑलमोस्ट 70% ऑफ द फाइबर्स ऑफ फेशियल नर्व. एंड जो सेंसरी नर्व रूट है दैट इज ऑल्सो नोन एज नर्वस इंटरमीडियस ऑफ रिसबर्ग. Okay, nervous intermedius of Risberg that constitutes almost 30% of the fibers of the facial nerve. जो sensory root है it contains not only sensory fibers but it also contains autonomic fibers. जो motor root है जिससे motor fibers निकलता है, जो motor fibers है it supplies most of the facial muscles or muscles of facial expression as well as it also supplies stapedius which is a muscle in the ear. जो sensory root है जिससे sensory fibers निकलता है, sensory fibers का दो तरह का function होता है. One is special senses, that is to carry the taste sensation which is a special sense from the anterior 2/3 of the tongue. And about general sensation, okay, it carries the sensation, general sensation from the eardrum as well as the external auditory canal, mostly the posterior portion of the external auditory canal. About autonomic fibers, they are parasympathetic secretory to certain salivary glands, that is submandibular and sublingual salivary gland, and also to lacrimal gland. So these autonomic parasympathetic fibers of the facial nerve ये जो है they are responsible for lacrimation as well as salivation from the submandibular and sublingual salivary glands. So this is about the distribution of the facial nerve, okay, and the functions of facial nerve. Now just a little bit about the anatomy of the facial nerve, though I will explain the anatomy in detail in other class. Facial nerve इसका एक supranuclear and एक infranuclear portion होता है. As the name suggests, supranuclear means above the nucleus. So facial nerve nucleus lies in the pons. तो न्यूक्लियस के ऊपर का जो portions है starting from the cerebral cortex, okay, just before synapsing in the facial nerve nucleus, that portion is known as the supranuclear pathway. And infranuclear pathway जो है it begins from the nucleus up to the terminal branches of the facial nerves. So facial nerve palsy can be of two types: upper motor neuron type facial nerve palsy where there is injury or lesion in the supranuclear pathway of facial nerve, and the other variety can be lower motor neuron type of facial palsy where there is injury or lesion in the infranuclear fibers or infranuclear pathway of the facial nerve. There is a little difference in the clinical presentation of upper motor and lower motor neuron type of facial nerve palsy. The main difference is that in case of upper motor neuron type of facial palsy, the upper half of the face will be spared. There will be no involvement of the upper half of the face, but the lower half of the face will be involved or paralyzed. But in case of lower motor neuron type variety or lower motor neuron type facial nerve palsy, the whole half of the face, that is upper as well as the lower half of the face, will be involved or paralyzed. Why so? Okay, I will discuss this in my next class. It is very interesting, and for that I need to draw certain pictures and images to make it very easily understandable to you all. So I will describe it in another class. and I will give the link in the description box. Okay, so please follow the link, and then you can know why there is sparing of upper half of the face in case of upper motor neuron type of facial palsy. Now coming to the examination of facial nerve, it starts from the inspection. So what are the things we can know or we should notice, okay, in inspection? क्या क्या देखना चाहिए हमको inspection में? First of all, हमको देखना चाहिए if there is any facial asymmetry or not. Okay, normally and especially in young persons the face is symmetrical. Okay, so look for any facial asymmetry. नेक्स्ट थिंग हमें जो देखना है वो है कि फोरहेड में रिंकल्स प्रेजेंट है कि नहीं, स्पेशली व्हेन द पेशेंट इज ट्राइंग टू लुक अपवर्ड्स, तो ऊपर की तरह देखने से रिंकलिंग आता है कि नहीं फोरहेड में, दैट इज इम्पॉर्टेंट. नेक्स्ट थिंग, ओके, लुक फॉर द पल्पेब्रल फीचर. पल्पेब्रल फीचर जो है वो वाइड है कि नहीं, दैट इज इम्पॉर्टेंट. ओके, नेक्स्ट लुक फॉर द नेजोलेबियल फोल्ड. Nasolabial fold, we need to look for the symmetry as well as the depth. Okay, and then look for facial abnormal movements, if there is any spontaneous abnormal facial movements or not. Look for the infrequency and if there is any asymmetry in the eye blinking. Okay, look for the tone. Okay, via inspection also we can judge the tone. Okay, whether there is flaccidity in the facial muscles of expression or not, that can be examined by inspection also. Okay, so suppose if the nasolabial fold is flattened, okay, nasolabial fold is flattened, asymmetric, but forehead wrinkling is maintained, so that will be a case of upper motor neuron type of facial palsy. As I said, upper motor neuron type of facial palsy में upper half of the face will be spared, so wrinkling will be present but there will be asymmetry or reduction in the depth of the nasolabial fold. If there is reduction or there is lessening in the nasolabial fold depth, okay, the depth is reduced as well as there is no wrinkling in the forehead, that means it is a case of lower motor neuron type of facial palsy. In case of lower motor neuron type of facial palsy, the palpebral fissure will also be wide, there will be epiphora, the patient will not be able to close the eyes properly, and whenever the patient tries to close the eyes, there will be uprolling or upturning of the eyeball and the sclera will be visualized. That is known as the Bell's phenomena. So please ask the patient to close the eyes. Patient will not be able to close the eyes properly and there will be uprolling of the eyeball and you will be able to visualize the sclera. Okay, so that is known as the Bell's phenomena, which is a very important finding in case of lower motor neuron type of facial palsy. Upper motor neuron type of facial palsy mein this will not be there. Okay, there will be no widening of the palpebral fissure also, because only the lower half of the face will be paralyzed, upper half of the face will be normal. Okay, so this is about the inspection of the face. There may be fasciculations, there may be atrophy, which is a sign of lower motor neuron type of palsy. Okay, look for abnormal movement also. Okay, there are abnormal movements like synkinesia, there may be facial, hemifacial spasm, myokymia. These are certain abnormal movements. Okay, spontaneous facial contraction, tics, chorea. Okay, these are the things which we need to look for when we examine for the facial nerve. Okay, this is all about inspection. Now there are certain examinations which you can do to find out if there is any motor weakness, okay, for the facial nerve. For example, you can ask the patient to close the eyes tightly. Okay, normally when the patient tries to close the eyes tightly with burying the eyelashes inside, it will not be very easy to open the patient eyes, force open the patient eyes. Okay, but in a patient of facial nerve palsy, okay, especially lower motor neuron type of facial nerve palsy, when the patient वी आस्क द पेशेंट टू क्लोज द आइज. आप आंखें बंद कीजिए हम बोलते हैं, तो पेशेंट विल नॉट बी एबल टू क्लोज द आइज वेरी स्ट्रांगली, देयर विल बी वीकनेस. एंड जो एग्जामिनर है, वो एग्जामिनर कैन फोर्स ओपन द आइज इवन विद द लिटिल फिंगर. ओके, इवन विद द लिटिल फिंगर, अगर हम स्मॉलर फिंगर्स के हेल्प से भी अगर हम आइज को फोर्स ओपन कर सकते हैं पेशेंट का, तो दैट मीन्स देयर इज वीकनेस इन द orbicularis oculi muscle. Okay, now how to examine buccinator muscle. Okay, buccinator, and then how to how to examine for the orbicularis oris. Orbicularis oris, it surrounds the mouth. Now a patient who is normal, you ask the patient to close the mouth with pursed lips. It will be very difficult for examiner to force open the mouth if it is normal. But if there is weakness of the orbicularis oris, then it will be very easy for the examiner to force open the mouth. Next, you can ask the patient to puff the cheeks, puff out the cheeks like this. Okay. अगर पेशेंट को फेशियल नर्व वीकनेस है, फेशियल नर्व पाल्सी है, देन इट विल बी वेरी इजी फॉर द एग्जामिनर टू फोर्स द एयर ओपन फ्रॉम द पफ चिक. ओके, वैसे पफ चिक किया, पफ चिक में टैप करने से अगर एयर निकल जाता है फ्रॉम दैट पर्टिकुलर साइड थ्रू द लिप्स, दैट मीन्स देयर इज वीकनेस ऑफ द फेशियल मसल्स और ऑर्बिकुलरिस oris of that particular side. Okay, now you can ask the patient to frown, you can ask the patient to corrugate the eyebrows. Okay, you can ask the patient to pull down the angle of the mouth, okay, with vigorous frowning, so that you can see the contraction of the platysma. Okay, that also you can do. I forgot to mention one more important thing in the inspection. Please look at the angle of the mouth. Okay, the angle of the mouth will be deviated towards the normal side. Okay, that is important. For example, suppose there is right sided facial nerve palsy, then the angle of the mouth will be deviated towards the left side. Okay, that is important in inspection. Till now हमने बात किया about inspection, what are the findings will be there in case of if there is facial nerve palsy. And we also discussed about the functions of certain specific muscles which are supplied by facial nerves and how to examine them. We can also ask the patient to clench their teeth, okay, or we can ask the patient to retract the angle of the mouth and baring the teeth like this. Then we need to see how many teeth are visible on either side. Okay, if there is any asymmetry, facial asymmetry, okay, these are the things we need to look for. Okay, and regarding the stapedius muscle, as I said, stapedius is a muscle in the ear which is also supplied by facial nerve. अगर stapedius muscle में प्रॉब्लम है तो पेशेंट को हाइपरएक्यूसिस होता है. सो व्हाट इज हाइपरएक्यूसिस? हाइपरएक्यूसिस माने लो टोन वॉइस भी, लो टोन साउंड भी पेशेंट को बहुत ज़ोर से सुनाई देता है और बहुत पेनफुल लगता है पेशेंट को. पेनफुली लाउड नॉइज व्हेन द टोन इज वेरी लो, दैट इज हाइपरएक्यूसिस. हाइपर, ओके, हाइपरएक्यूसिस. तो इफ देयर इज इम्पेयरमेंट ऑफ द नर्व सप्लाई ऑफ द स्टेपेडियस मसल, देयर विल बी हाइपरएक्यूसिस. पेशेंट को कंप्लेन होगा ऐसे कि लो टोन वॉइस भी पेशेंट को बहुत ज़ोर से सुनाई देता है. एंड दैट कैन बी इन्वेस्टिगेटेड बाय इम्पिडेंस ऑडियोमेट्री. इम्पिडेंस ऑडियोमेट्री के ऑडियोमेट्री करने से हमको स्टेपेडियस रिफ्लेक्स का पता चलता है, वेदर देयर इज कंट्रैक्शन ऑफ स्टेपेडियस मसल और नॉट. दैट कैन बी आइडेंटिफाइड फ्रॉम द इम्पिडेंस ऑडियोमेट्री. नाउ कमिंग टू द स्पेशल सेंसेस. ओके, special sense, that is facial nerve, it carries the taste sensation from the anterior 2/3 of the tongue. तो कैसे हम टेस्ट सेंसेशन एग्जामिनेशन करेंगे बेड साइड में? नाउ फर्स्ट ऑफ ऑल we need to prepare the things with which we are going to test the patient. For sweet we can carry sucrose, okay. For salty we can carry table salt, that is sodium chloride. For sour things, sour taste, we can carry citric acid. For bitter, quinine can be carried. Now, what is the method of examination? Just you make sure that once you put a substance in the tongue, patient should protrude the tongue, and once you put a substance on the tongue, patient should not be allowed to take back the tongue inside. Okay, because once the patient takes back the tongue inside, then there will be dispersion of the substance all over the tongue, and the result will be faulty. Result may be faulty also. So what you do is that after testing for each substance, you ask the patient to rinse the mouth. Okay, mouth को पूरा rinse करना है before you try with the next substance. Okay, जो tongue है anterior 2/3 में, anteriorly usually in the tip of the tongue the sensation is little low. It carries sweet sense. Okay, and laterally it carries salty and sour sense. Okay, so according to the area wise we can put the substance after the patient protrudes the tongue. Okay, and then we can ask the patient to let us know which taste it is by writing in a board with pen and paper. Writing in a board with pen. Okay, we can write like sweet, salt, sour, bitter, and then we can ask the patient to show us which taste he is feeling in his tongue, because we will not allow the patient to take back the tongue inside, so patient will not be able to talk. So patient can just with the gesture patient can show us. If we show the patient on writing, then patient can tell us what is the taste the patient is feeling. Okay, so this is how हम examination करते हैं about taste sensation. About lacrimation, skimmer test can be done. Okay, and about salivation, if there is any problem in the salivation, that will be evident from the history. The patient will tell that there is dryness in the oral cavity and the patient finds it difficult while chewing. Okay, because while we chew substance there will be release of saliva which helps in the chewing and digestion. But if there is no saliva coming out, then the patient will complain of difficulty in chewing and very much dryness inside the oral cavity. So this is about the autonomic function of the facial nerve. So we have talked about inspection. Okay, inspection, what are the findings we'll get. हमने बात किया about different muscles which are supplied by facial nerve and how to examine those muscles. Okay, हमने discuss किया about the examination of taste sensation, that is a spatial sense which is carried by the facial nerve. हमने और भी discuss किया how to examine for the autonomic function, that is secretory function of the facial nerve. तो ये सारे हो गया bedside test. Okay, with which we can identify if there is facial nerve palsy or not. I hope this class was helpful. Thank you so much for your attention.